As you know, we assumed office a little over a week ago, and this is what we found. There was no clear strategic plan with a budget. There were no clear testing strategies. Up to the end of July, MOH headquarters was still deciding who got tested. The processing of swabs for PCR was and is still centralized. This has resulted in a serious backlog. Currently, there is a backlog of approximately 2,182 PCRs at the central lab waiting to be processed. People being tested are not being given their results in time. This has contributed to the spread of COVID. Despite a clear offer from BAHA and the IAEA in April to assist with PCR testing to the MOH, this offer was not taken up. Our government hospitals are not fully ready to deal with a surge in cases should the need arise. This is despite the fact that the MOH had ample time to rectify and address these gaps. The Ministry of Finance reduced the budget for all ministries, including MOH, by 40%, and this is despite the fact that MOH is required to respond to the pandemic. Overtime for healthcare workers was cut. There were restrictions placed on the hiring of staff. There are limited masks and P.P.E.s for healthcare workers. There was a lull during the lockdown for approximately 1 month where there were no cases reported. The previous administration should have used this time to develop a clear strategic plan to deal with the pandemic and to equip hospital and healthcare workers with the needed supplies. And this is compounded by the shortages of doctors, nurses, testing equipment, etc.